webinars. So this webinar is being recorded and I will upload it to my YouTube channel. Those of you who are familiar with, with my monthly webinars, you know that every month, third Friday of the month, I do a webinar. And this time, so the last 6 months, these were topics that most of the time I get asked about. This time I had asked all of you to suggest topics, and thank you so much for doing that. And I am going to get started because as always, I have lots to talk about, and I always like to give you things that you can do for yourself rather than, yes, prescription medications are very important. I'm a physician, but there are a lot of things you can do for yourself for your hypertension. So the topic today is hypertension or high blood pressure, and what can you do in addition to taking prescription medications. And the problem with hypertension is, number one, it is extremely common. And women, so by background, I was an OBGY before. So women's health obviously interests me a lot. And not just because I was an OBGY, because it's a personal interest as well. So women after the age of 60 have a higher incidence of hypertension. And the other big problem with hypertension in general is because most of the time it doesn't have any symptoms. So people don't realize they have hypertension unless they actually get themselves measured. And I am going to talk about what are the best ways to measure your blood pressure. And so for many people, unless they go to the doctor or to the pharmacy, or, if they have a blood pressure instrument at home, unless they've actually checked their blood pressure, sometimes they don't know they have hypertension. And the other big problem, which is a really serious problem now and many parts of the world, and I know for sure in India, where most of my patients are from, it's a very big problem, which is young hypertension. Now, hypertension, earlier when, maybe even 10, 20 years ago, young hypertension was described as people who were younger than 30 years. But in the Indian context, like it is for, heart disease, stroke, all those conditions, heart disease particularly, South Asians, people from India, Bangladesh, Pakistan, Sri Lanka, these countries, they get heart disease about a decade earlier compared to the rest of the Western population. Similarly with hypertension, actually a study done in India found that young people in above the age of 19. So this was a study where they looked at people above the age of 18. So very young people in their 20s had hypertension, and obviously most of them did not even know that they have hypertension, because a lot of people still think, oh, hypertension is my parents' generation problem, or it's my grandparents' problem. It can't be my problem. I'm too young to get hypertension. My point is, no one is too young to get that. But the thing is, a lot of the time people don't know because they don't measure. And hypertension does not have a lot of, I'm not saying all hypertension does not have symptoms, but most people don't have symptoms. It is usually detected when it is actually measured. So why should we be so, concerned about hypertension? I'm going to start sharing a screen. So the goals for my webinar is, number one, to talk a little bit about what the problem is, but I like to focus more on, what can you do for yourself? So why should you be concerned about hypertension? As you can see in this picture this is from the heart.org website, stroke, heart failure, vision loss, heart attack, kidney disease. Sexual dysfunction is not something that is talked about a lot because most people don't connect their hypertension with sexual dysfunction. Sexual dysfunction in men particularly, and erectile dysfunction is a very common problem. And hypertension could be one of the factors. Even sexual dysfunction in women is something that most of the time we don't discuss. One of the reasons is because there's so many things to talk about. Sometimes it gets pushed to the background, and sometimes it's like ignored because we don't want to talk about it, or there's a lot of stigma associated with it. However, in sexual dysfunction, and particularly erectile dysfunction in men, is also a major, major red flag is what I would say, to look for other conditions. So things like, what else? Diabetes is a big one. Then some medications can also cause problems, but hypertension is often ignored. One more area which I have added is dementia. So having hypertension in middle ages is related, and by hypertension I mean uncontrolled hypertension. So uncontrolled hypertension in the middle ages is related to a higher incidence of dementia in later age. And the other problem, when I was talking about, most people don't know they have hypertension, even amongst people who do know they have hypertension and they are taking medications, many of them have not reached their target blood pressure. Now, target blood pressure, I'm going to come to that a little bit later. So what is what is important is, again, I want to highlight what you can do for yourself. So I'm going to sort of rush a little bit through these. Now, this one and the next slide are two slides which you'll probably see on every monthly webinar of mine, because functional medicine perspective is a little different from how, in traditional Western medicine we look at. Now, I have to use the term traditional in two different ways. In India, traditional Western medicine is Western medicine, whereas in the rest of the world, traditional would mean Ayurveda or homeopathy or any of that. So it is medicine that is commonly practiced all over the world, which is, how it looks at, and I was an OBGY. So we look at it as silos, but the body is not built as silos. The body is a network of networks. So for example, in terms of hypertension, most likely hypertension would be treated in some parts of the world, it is treated by the family doctor. In other parts of the world, in countries like India, where people can meet a specialist very easily, they don't have to wait for a reference. They may be going to their cardiologist, or it could even be the neurologist. And the neurologist is not even included in this list here. I'm sorry about that. So the fact is, or if they have, diabetes along with hypertension, it could be an endocrinologist or a diabetes specialist looking after them. But hypertension would impact every part of your body. So in the functional medicine world, this is how we look at any condition, whether it is hypertension, whether it's diabetes, whether it is your gut dysfunction, your hormonal profile, everything is looked at in this network view. So as you can see, in this, and those of you who have attended my previous webinars, that I talk about my constellations. So everything is related. However, in traditional medicine, we don't often address all the areas. So whether you look at, the guidelines for treatment of hypertension, the first thing mentioned is lifestyle modification. Now, therein comes the problem, because we have been taught, and I have myself done it, so I'm guilty too. What we feel that, lifestyle modification is just like, food and exercise and sleep. People know that. People should know that. The thing is, you give them a handout, tell them these are the things you need to do. And as physicians, we expect that once you give a handout, you give people information, you bludgeon them with information, they're just going to go home and do all of that. Now, that doesn't work. Not only does it not work for you if you are thinking of yourself, it doesn't even work for us. Like, obviously, doctors should have been the healthiest people on earth, right? Because they know so much, but they are not. So obviously, the system of giving more information, it doesn't really help. We need to have a structured way on how to make therapeutic lifestyle changes. That is where, which is, number one, it is not even taught in med schools unless you have specialized in lifestyle medicine. So it's a very different kind of a different field altogether, and we are still learning a lot about that. So going back to blood pressure, how do you measure blood pressure? Now, you will, if you have checked any of the hypertension guidelines, you know that what it says is out of office blood pressure measurement. Now, this term out of office actually is somewhat confusing for a lot of my patients in India, because for them, many of them have asked, do you mean like, why would I measure my blood pressure when I'm in my office? So no, this is not your office. This means the doctor's clinic. So I wish the whole world used the same terms. They don't. So in many countries, the doctor's clinic is called an office. It is not so in India. So it has a lot of my patients in India quite confused. So basically what it means is measuring blood pressure in more of a natural environment. For example, number one is the 24-hour ambulatory blood pressure measurement. That is, you wear a blood pressure cuff for 24 hours and you have like a device which hangs across your shoulder, and it depends on the settings. So every half an hour to 20 minutes or so, the blood pressure cuff inflates and then it measures blood pressure like you would do anywhere else. And even over the night, so usually the settings are such that at night you're not disturbed every 15 minutes. It's usually more like every half an hour. So that instrument keeps measuring your blood pressure. So we get a 24-hour picture of your blood pressure. And as I have explained every time, when you go to the doctor's clinic, the doctor puts in, or the nurse puts the blood pressure cuff, and you might have just rushed into the office. You're supposed to sit for 5 minutes, don't talk, both your feet on the table, on the floor, sorry. But sometimes it's rushed, and ideally the instrument should be an automated blood pressure instrument. So that is just a single screenshot versus doing a 24-hour ambulatory blood pressure measurement gives you a video of what is going on. And particularly, it also measures blood pressure during your normal day. So ideally, you should not be doing it on a weekend, which is, you are relaxed more and, not those kind of situations, because most of your day you spend at work and, things like that. So preferably a weekday. Of course, if there's no other way, then of course a weekend would be okay, but not. That is number one. The other thing is the nighttime blood pressure is extremely important. So if you are my patient, you know that I recommend 24-hour ambulatory blood pressure measurement for everyone. And the good thing is, I know we have some people from the UK here, and I have talked to some family doctors in the UK, and they say that it is covered by NHS. So you can get it done if you're in the UK. In Canada, I know you can get it done because I work with a physician in Alberta, and she usually refers patients to a cardiologist. So it is covered by healthcare. It's not a specialized test. And in India, of course, people have to pay for it, but it doesn't cost a lot. So it's about 2,500 is the highest I've heard. There are ones which cost even less. So that's like about equal to about 50 Canadian dollars, so which is not a lot of money for a test which gives huge amount of information, which you cannot get even with a home blood pressure monitor. Next comes home blood pressure measurement. So there are some validated instruments, and on my hypertension post on my website, you will find the link to that particular website. So your number one, your instrument should be a high quality one, a validated one, because, and sometimes it may not be the cheapest one. So the cheapest ones may not give you accurate reading, because accuracy is extremely important. And there is a certain way on how you measure your blood pressure. So ideally, I need at least 12 readings to be able to decide whether your blood pressure is under control or not. Ideally, I would have loved more. So 2 weeks, morning, afternoon, evening would be perfect. But I know, it's like I have tried that myself, and at the most I could do was morning and evening. Morning and evening, 12 readings for over a period of 10 days or 14 days. It doesn't even always have to be consecutive days, but 12 readings morning, evening would give me sort of a better image, than a better picture about your blood pressure than, just measuring once at the doctor's clinic or the pharmacy, wherever you go. So this is one important thing about measurement. So when people tell me, doctor, I don't have hypertension, most of the time I have to ask, obviously, how did you measure it? So if it was not done in one of these two ways, ideal is the 24-hour ambulatory blood pressure measurement. If that says your blood pressure is normal, then okay, then I would accept that, or a home blood pressure test. Other than that, just checking at the doctor or the pharmacist, or even at home, you just checked it once in a year, that is not enough for me. So what are the different blood pressure categories that we are looking at? This is from the American Heart Association. As many of you probably know, in 2017, the new guidelines came up where normal blood pressure is less than 120 by 80. You know that blood pressure, there are two numbers. The systolic is the upper one, diastolic. And in case you get confused between which is the systolic and which is the diastolic is down, D. So 120 by 80 is normal blood pressure. However, there are lots of, sometimes blood pressure targets have to be personalized to each person because based on what other conditions they're dealing with. So that is a conversation that you need to have with your doctor. But my point is, I have had patients, tell me, doctor, my doctor says 140/90 was my last blood pressure, and that is normal. No, that is not normal. That is not something you can sit at home and sit on it. So my point is, know what the numbers are. And for some of you, and of course, I mean, anything higher than that, that is high. But and some, actually, there are a lot of studies now showing that probably a systolic blood pressure of 110 would be better. But there are lots of ifs and buts, in the sense is, how are you achieving that blood pressure? Are you achieving it by only medications? That is not what we would recommend, because let us say moving from 120 to 110 systolic means adding 2 more prescription medications. Now, personally, as you know, I would not be as much in favor of that, versus, yes, prescription medications are necessary, but to get you to that last sort of the final step, there are so many other lifestyle changes you could make. There are supplements you could take, which, so my view, over the ages, it's like over the last few years, I've realized that managing hypertension is going to be very important to use both prescription medications. Lifestyle change has always been, stressed upon, but like I talked about all the challenges of lifestyle change. And the third thing is supplementation, because as I mentioned about young hypertension, many of these blood pressure medications have not been tried on young people for a long period of time. So a combination, and most of the time when people come to me, most of them would much rather add another supplement or a lifestyle modification, like in their food or in daily exercise or things like that, rather than add another prescription pill. But my point is, the most important thing is to get your blood pressure to the target range, which often involves a combination of lifestyle supplementation as well as prescription medications. I am not for against anything like that. This is not a cult. This has to be supported by science. So the goal is to get your blood pressure to the range which is best for you, without doing a lot of things which can. So some of the blood pressure medications, they may increase the risk for fall for older people. So that is why I said, in older people, in certain kidney conditions and these conditions, it is a much more, that calls for a one-on-one conversation rather than giving some generalized recommendations here. So I call hypertension and type 2 diabetes the evil twins. Now, a few days ago, I was in a conversation with other specialists, and they said, yeah, it's about probably 60% of people with diabetes have hypertension. I said, I am quite sure it is more. It's just because they have not been screened using a 24-hour ambulatory blood pressure test, or they have not done the home blood pressure monitoring the way it should be done. So sometimes, interestingly, and today I don't have that diabetes continuum slide of mine, some of you have probably noticed that you have hypertension diagnosed, way before you were told that you have diabetes. Now, that, diabetes is, your doctor would diagnose you with diabetes when you cross a certain threshold of your fasting blood glucose numbers or your post-meal blood glucose numbers. But in the functional medicine, we are in the predictive preventive world. So I'm not going to wait for your fasting blood glucose to go beyond, what the lab says is diabetes. I can tell you about things that you can do. And many patients have done that. So it's not like no one has ever done it before and it can't be done. No, many people have done that. They've started taking action way before blood pressures have reached those kind of levels. So that is one thing. But remember that if you have hypertension, you do need to be screened for diabetes, of course. And even if your doctor says, oh, you don't have diabetes today, remember that, higher than normal blood glucose levels are definitely not good for you in terms of your heart, your brain, your mood, anything, you name it. Primary and secondary hypertension, I am not going to go into that in the interest of time. So the primary is the most common, or what we would say, though there's nothing garden variety about hypertension. But secondary hypertension, most of the time it is secondary to some other cause. The commonest causes are endocrine problems. There are some hormonal problems, like one of the commonest ones, which is not often diagnosed, is because the doctor is not thinking of it, is something called primary aldosteronism, and I'm not going to talk about it here. But I do have a video with a specialist endocrinologist, and she talks a lot and describes in detail all the different things that happens in primary aldosteronism. And newer studies are showing that primary aldosteronism is more common than it was thought before. So if you are someone whose blood pressure is not being controlled even after 3 medications at the highest possible dose, even after trying everything else, or you have early kidney disease, or any of, in our terms, we call end organ damage, or eye damage, or heart damage from hypertension, you definitely need to talk to your doctor about ruling out primary aldosteronism. So as you can see, my list is long. The list was actually longer, and of course I cannot cover everything here today, but these are some of the things, and I will try to talk about as many of them as possible, because I want to be mindful of your time, and I want to leave time for questions. And by the way, if you have attended my webinars before, now I have figured out that I can unmute you for you to ask questions, like the audio I can unmute. You will still not be seen on video, or you can of course use the chat option that is always there. So this is, again, no apologies for how complex it is, because your body is complex, and that is the reason we have been, we are living so long. Otherwise, we would have been an extinct population a long time ago. So I know many of you in the audience, some of you are physicians, so you want to know, how is diabetes connected to hypertension? I've talked about insulin resistance before. So this is what insulin does in many different ways. So vascular inflammation, that is inflammation of the lining of the blood vessels, that is extremely important. Nitric oxide and free fatty acids, then, TNF alpha, IL-6, IL-1, these are inflammatory markers. You know about sodium, sodium is very important for hypertension. All these different ways, sympathetic nervous system, all those different hormones that are secreted when you are stressed. Insulin impacts in so many different ways that it is extremely important. So I don't want to get into that in details, but for those of you who like to know the details, the minutiae, this is a very good paper. The reference is there at the bottom of the slide, and I will post these slides on SlideShare. So if any of you want to take a look, you can do that. Now, prescription medications for hypertension, we call them the ABCDs. So all of you, if you have hypertension, you are on one of them, or you're on a combination, or you're on 3 of them. And again, like I said, that depends on what else is going on with you. That is a conversation for you with your doctor. So ABCDs are ACE inhibitors, ARBs, beta blockers, calcium channel blockers, and diuretics, or the water pills. Why I'm showing this is, when I talk about, nutrients, obviously, that supplementation is one of my areas. As you can see in this, there are so many different minerals and nutrients necessary. So if you ask me, Dr. Carr, what is the one supplement I should take for hypertension? Now realize why I can't answer that, because see, there are so many different: sodium, potassium, calcium, magnesium, zinc, copper, selenium, vitamins, B6, B12, vitamin C, vitamin D. These are just, and this is how it causes it impacts blood pressure levels. So when there are so many different nutrients involved, I cannot, we do not have those tests easily available. There are tests available which can actually measure the nutrient levels at your cellular levels, which can give you a much more customized recommendation of which particular vitamins and minerals you need to take. But whatever it is, whether it is, just based on my experience and what I've seen happening in patients, I give you a supplement recommendation, whether it is after doing a specialized test, The point is, it will always be quite a lot of supplements. So it's not like, because some of you, I know some of you feel, oh, I'm just, she just gives me more and more pills. Well, there is a big difference between supplements and prescription medications. Because as we say, in our world, prescription medications, all of them have some side effects. Sometimes it's long-term use, sometimes it can show up earlier, but most supplements don't. They are much safer, they don't have as many side effects. So the decision is yours, whether you are comfortable. Like recently someone was telling me, you take so many supplements every day, and I cannot do that. And I didn't want to tell her, and I didn't tell her that. And I'm thinking, I take supplements, yes, because I don't want to have an offline brain like yours. Not that supplements alone will keep my brain fit, but that is one of the things I do. Because obviously, I take more supplements than I have prescription medications. And I know the person telling me, she has a whole, like, she carries a pharmacy with her. So it's different things for different people. And there should be no judgment either from your provider or from you. Definitely. It's not like, oh, I just need all these things to have a better life. Yes, of course, we always have to make decisions, and there are always trade-offs. So 2 slides ago, I talked about the different antihypertensive prescription medications, the ABCDs. So here again, even amongst the supplementations, these are ABCDs again. So ACE inhibitors, melatonin, ARBs, these can work like that. CCBs, all these can work like that. And directly renin inhibitor is vitamin D. So always the question is, which ones would I choose? So it depends on, number one, what are the end results I'm looking for? For example, some of my favorite when it comes to hypertension, and not just hypertension, you know that if you have been my patient, you know that magnesium, omega-3 fatty acids, vitamin D, probiotic, and a multivitamin is something I recommend to everyone. Magnesium is so important because it is involved with 300, 400 different enzymatic reactions in your body. And no one can get enough magnesium from only food. You will have to eat about 8 cups of spinach every day. I don't think anyone can do that. Then next comes omega-3 fatty acids. I have talked about omega-3s before. They are essential fatty acids. That means your body does not have the ability to make them. Now, let us say if you come to me and you have high triglyceride levels, you have, you're feeling anxious, you want better brain fitness, you have aches and pains, a lot of stuff. Definitely, I would prioritize the omega-3 and a higher dose for that. So versus someone who doesn't have all those conditions, I would probably, because I know it's always a negotiation. You'll say, doctor, I can't take 7, 8 different supplements. So if I have to prioritize, I would probably prioritize omega-3s, magnesiums over anything else. Now let us say, you can see vitamin C here, very important. One of the things is, if you have high uric acid levels, and you can get a blood test done anywhere in the world, high uric acid levels, and high uric acid levels is more than 5, and I will send a post on uric acid levels and how to reduce them. I haven't written it yet, so hopefully it'll be ready soon. High uric acid levels are also related to hypertension, and you may not have any gout at all. So gout, high uric acid is not just about gout. Even if you don't have gout, it is important to bring down those uric acid levels because they contribute to your hypertension. So studies have shown that if uric acid levels are brought down lower than where they were before, blood pressure can fall by at least 4 to 5 millimeters of mercury. And 4 to 5 is about as much as many of the antihypertensive medications would give you, the kind of numbers. So again, I am going to start rushing through. So what is the other thing? Sitting interrupted. Continuous sitting, as I have talked about this before, is, it's really extremely harmful. We have more and more studies showing that. So some time back, there was a study where they looked at, so what they did is, a group of people who spent a lot of time sitting continuously. And as you know, in my intake questionnaire, I have a sitting risk score calculator. So if you are spending a lot of time sitting in front of the TV or in front of your computer or at work or wherever, Even if you have exercised in the morning, you've gone to the gym, you've done your half an hour, or even if you have done your 10,000 steps by walking for 1 hour or 2 hours in the morning, and then you come home and you're like sitting continuously, that will undo all the benefits of all the exercise that you have done. So what they did is they looked at people who had a higher risk sitting score. So they were sitting for 6 to 8 hours every day. And what they asked them to do is every hour or so, just interrupted by even a 3-minute exercise. So you just had to stand up every hour. And some of the wearables that, many of you are using smartwatches or wearable devices, you can set it in the settings to prompt you to get up. So you get up, go around a little bit here and there and come back and sit again. So you've interrupted that continuous sitting. That has helped in reducing blood pressure, bringing down blood glucose levels. So my point is, if you feel that, if you are someone who loves exercising, you go to the gym regularly, that is awesome. But if you are someone who's thinking, how will I do it? I don't like exercising. I don't like doing this. I don't like doing that. Maybe just start with baby steps. Start with, just interrupting your continuous sitting. So quite often people ask me, what is the best exercise for whatever, hypertension, losing weight, this, that. My answer is always the best exercise is the one that you will do. So if it is walking that you love, fantastic. Walking has so many benefits. If you don't like any kind of exercise, or you have physical limitations, you have a lot of pain, or you can't walk around very comfortably, there are so many options now. You can just go to YouTube and you can look for chair exercises, lots of videos, lots of stuff. And one of my favorite, walking at home videos, I have sent that to some of you. So just go to YouTube and look for walk at home. So now with winter coming, not too far away, I am going to do more of walking at home, because I am afraid of, what if there is, like, I fall in the snow and break my bones or something. I don't want to do that, but I can safely walk at home. So many different ways on how you can interrupt continuous sitting. Whenever you check any website on, what are the lifestyle changes you can do to manage your blood pressure better, you will come across food recommendations. And what is the first food recommendation that most of you will read is reduce your sodium intake. So in the interest of time, I'm not going to go into details about sodium. Maybe Mikhail and I, so my wonderful associate Mikhail, who's a nutrition consultant, she and I will probably do a podcast or a video on food in hypertension, because when I was preparing for this, I realized, there is so much to talk about food and hypertension. So yes, excessive amount of salt is dangerous, but not everyone is salt sensitive, has salt sensitive hypertension. So that is going to be for another conversation. But yes, you can check what are the food you're eating. So a lot of processed food, and amongst South Asians, lots of the pickles, like the achars and the papad, those have a lot of high salt. So number one is, there is no simple, easy test to do, which will tell us whether you are salt sensitive or not. Best thing to do is review your food information and see if you have very high salt intake. Now, the point is, you don't need to eat bland food if you have hypertension. But the thing is, not everyone is salt sensitive. So once you remove the high salt food, check your blood pressure before and after doing that, maybe over a period of 2 weeks. I wish there was a simple test. I'll just tell you, just go and do this and you know whether you're salt sensitive. That test is not there yet. Anyway, so and you know that I am a low carbohydrate diet proponent. I always talk about it. So this is from the work of Dr. David Unwin, who is a family doctor in the UK. Many of you have probably, watched him on videos and heard him speak and on podcasts in numerous places. So what he did is they used a low carbohydrate diet. And he is a family doctor in the UK. So this is in regular NHS practice. They found that blood pressure reduced by 10.9 millimeters so almost 11 millimeters of mercury, and diastolic blood pressure of 6.3. This is major. Many medications do not reduce it to this level. They would reduce it by about 4 or 5 millimeters only, not 10, not 11 and 6. And there was, of course, a mean weight reduction of 9.5 kilograms, which is about, that would be about 19 pounds, 19 or 20 pounds, and marked improvement in lipid profile. So your blood fats, all the LDL, HDL, and triglycerides and total cholesterols, they were better. There was a 20% reduction in antihypertensive medications. So they had to stop or reduce the dosage of some of the medications because blood pressure was going down too much. So this is based on a low carbohydrate diet. Now, all of you have heard of the DASH diet, which is the dietary, I'm blanking out on what the A stands for, dietary approach to stop hypertension. So DASH diet is something that everyone knows. Any website they talk about hypertension, they'll always talk about the DASH diet. Like I said, Michal and I need to do a special session on food and hypertension separately. So the DASH diet, of course, again, eating real food, no sugar, no processed food would have a huge impact, and very little alcohol as well on that. So which one should you follow? It depends. It's rather than putting your food into definite, this is low carb, this is high fat, this is ketogenic, this is this, eat real food instead of eating the ultra processed, sugary, simple carbohydrate food. Prioritize protein. You've heard me speak about that so much. So prioritize protein is very important because protein will keep you satiated long term. Protein contains, amino acids, some of which are essential amino acids. Your body doesn't make them. And most importantly, it will keep your blood glucose and your insulin levels in a much more even keel. So prioritize, and most of you are not eating enough protein. So obviously, if you eat enough protein and good quality fat, there's hardly any, there isn't enough space left on the plate to put any carbohydrates like, bread, pasta. In the Indian context, it would be rice, rotis, all those things. None of those are essential nutrients. Your body can function quite well without those. So what type of food would you take? Again, it depends. Each one is different. The big, this is a conversation I was having with Dr. I. We recorded a video on fatty liver. So most of the time, there are many people even today who think that a fruit juice or a fruit smoothie is a health drink. It is not. If you have to eat fruit, and again, like I said, fruit is something that comes from nature. But when you eat a whole fruit, which has the skin and everything, it also has fibers. Number one. Number two is you will definitely not be able to have like 5-6 whole fruits at one sitting. But for a fruit juice, it's very easy to have like 5-6 oranges in one, and you add some pineapples to it, or a smoothie, or you add some mangoes to it. It's quite a big, fructose bomb. So fructose is one of the big problems because it goes directly to the liver and makes liver fat. It does not raise blood glucose levels. It does not raise insulin, but it impacts your leptin levels. Those are other hormones that impact your metabolism. It also impacts, your satiety. You can eat or drink more after you have a fruit smoothie or a fruit juice. You feel hungry earlier. Then all these, the soda, in India, they call them, soft drinks. Those are also, because some people, I've seen it happening at, parties when people get together. They are not having the red wine or any other wine, but they are going for the soda. Now, many a time I've wanted to tell them, not that alcohol is a health food. No, I'm not saying that, but they would probably be better off choosing the red wine over the soda, whereas they think they're making a very good health choice because they're not having the alcohol, but that may not always be true. Next is alcohol and blood pressure. So as you know, many of you have probably seen this image, which is there in my intake questionnaire. So how much is too much? 1 drink or less for women and 2 drinks or less for men. Now here, this image, I'll show you what 5 ounces of red wine is in the next slide. This is a little, this is not 5 ounces. This is a whole lot more. So 5 ounces of red wine is very little red wine. I'm going to show that. So the point is, do you know how much you are? And again, I love red wine. So it's not like, I'm going to be the sanctimonious doctor here. So do you know how much you are actually drinking? Because you may be drinking more than what you think you are. So that is something very important to keep in mind. So like I said, I'm going to show you. So this is how this I actually measured using a peg measure. This is 5 ounces of red wine, which is considered to be one drink. And if any of you have found a way of, just having one glass of red wine, which looks like this, let me know. We are probably going to, have a session and discuss on how we can look at reducing drinking, if that is one of the issues you're dealing with, because reducing alcohol intake has shown blood pressure levels to fall as well. But alcohol is not everyone's problem. So obviously, sometimes it happens, I'll say, okay, alcohol is another area. I don't drink, doctor. I said, no, it's not for you. That is the problem when I have to give generic, recommendations. Doesn't apply to everyone, but it may apply to some people. And then again, going back to all these different areas that are extremely important. So like I said, I have more tools in my toolkit than prescription medications only. Now, I just wanted to bring talk a little bit about weight loss, because what is significant weight loss in medical terms? So just losing even 5 to 10% of your body weight. Now, losing 5 to 10% of your body weight may not take you to, the image that you have that you want to achieve. And I'm not saying you should not achieve that, but sometimes some of my patients, I've found that what they feel is, if I have not lost, 10 kilograms, 20 kilograms, that's like 20, 40 pounds, then this is not like, I should not be so thinking about it. That's not success. No, for blood pressure to come down, for your blood glucose levels to fall, you may not even need that high weight loss. But of course, important point is, are you maintaining that weight loss? So weight loss is one of the most important things for hypertension, as well as for diabetes, for any other, for reducing a risk for cancer or everything else. And the other big one is deep sleep. Deep sleep is one of the best antihypertensive medications, as sleep researcher Dr. Matthew Walker says. So deep sleep is extremely important. These are lowering uric acid levels, even if you don't have gout. That is not something that a lot of people talk about. Alcohol is another one. Then, of course, many of you, ask me about, what about meditation or relaxation response? Yes, that is important, but the fact is, you need to do it for a considerable amount of time. So that is the relaxation response. And most importantly, you need to check your blood pressure to see whether it is actually giving you the benefits that you think it is. Don't assume, that is one of the things I wanted to highlight. And I think that is the last slide. So I will stop sharing my screen, and I will, if any of you have any questions, just raise your hand and I will unmute you so you can ask, or please feel free to type your question in the chat box. And if you think of something later on, just feel free to email me at info, INFO, @drkarmd.com, DRKARMD.com. And I will, if it is possible for me to respond on email, I will. I don't see any raised hands. Okay. So thank you very much for joining me here today, and see you next month again. And in the meantime, if you have any questions, any queries, anything you want me to address at the next webinar, I'll happily do it. And I do hope you found this helpful. Would any of you like to share in the chat box something that you learned today that you didn't know before, or more importantly, is there any action that you're planning to take, after, based on some information that I shared today? Feel free to type in the chat box, or you can raise your hands and I'll unmute you. Okay. I don't see any raised hands. Thank you very much, and bye now.